ADD is a relatively recent disorder. Because of this, new information is being discovered yearly. Originally, it was thought that there was only one type of attention deficit disorder, and that was the hyperactive variety. In the 1950s, it was believed that only boys who displayed hyperactivity had attention deficit disorder. These boys were supposed to outgrow the disorder by the age of 13. It is now known that no one outgrows attention deficit disorder, but learns coping skills instead that can at times mute the symptoms. Gradually, many people who displayed hyperactivity as children learned to be quiet and blend in. This hyperactive type of attention deficit disorder, more commonly referred to as ADHD, does occur more often with boys, but certainly happens with girls as well. This hyperactivity might be shown outwardly by an inability to sit still or the tendency to tap a foot or hand as if they were keeping time. However, the hyperactivity might simply be felt internally as if the body is churning, but without any outward signs. There are many symptoms of ADHD. The child or adult may feel restless or be hyperactive, fidget, interrupt others, and talk excessively, have a difficult time keeping quiet when quiet is called for, and trouble waiting their turn. They often act impulsively or feel as if they are driven by a motor. Based on Dr. Amen's diagnostic symptom, if 4 of these symptoms are exhibited, it is possible to have the disorder. If 5 are noted, then it is probable. But to make an accurate diagnosis of ADHD, 6 of these symptoms must be present. A clinician would feel sure of the diagnosis if 7 or 8 symptoms are noted. The SPECT brain imaging scan of hyperactive ADD looks exactly like the scan at the beginning of this discussion. The blood and electricity have drained out of the prefrontal cortex, leaving the logical brain running at essentially 60% of its capacity. The usual treatment for this disorder is a stimulant, which would include Adderall, Ritalin, Vyvanse, Provigil, or others of that classification. The natural supplement Addr may also work quite well for many of the symptoms consistent with this type of ADD. Years later, inattentive ADD was discovered. This type of attention deficit disorder is not well known and much harder to diagnose due to the lack of hyperactivity. However, it is a very common type of ADD. In fact, the symptoms of inattentive attention deficit disorder are present in all 6 types of ADD and must be present in order to make the diagnosis. It bears repeating that in order to make an accurate diagnosis of attention deficit disorder, there has to be 6 or more symptoms that occur frequently or very frequently on the inattentive symptom list. For any other type of ADD to be positive, a person must have 6 or more positive answers on the inattentive symptoms and 6 on the section in question. It is best when making a diagnosis to have the person think of how they were as a child in school and not when they were passionate about an activity. Often, people learn coping mechanisms in adulthood that camouflage the symptoms of ADD. Remember that ADD is most often seen when a person is doing day-to-day or mundane tasks. For accuracy, it is best to also ask someone who knows the person well to answer the same questions for their view of the person. Frequently is essentially 15 to 20% of the time, and very frequently is 25% or more. Many of the symptoms listed are similar to those used in Dr. Amen's ADD test. The symptoms for inattentive attention deficit disorder are feeling spacey or preoccupied, a tendency to daydream, and difficulty keeping an organized area even though the person might know where everything is. People with an inattentive ADD often have trouble listening when other people are talking. This is especially true in a crowded room. A person with this disorder may be paying attention to the people in their own group, but periodically their attention is drawn away to the conversations of the other people around them. There is also a tendency to lose or misplace things such as keys, pens, or a phone. People with ADD often appear apathetic or unmotivated if they're not dealing with something that is a passion for them. Someone with inattentive ADD often has difficulty with their attention span. The way to assess this is to ask whether a person starts and completes a task before moving to another one. People with ADD characteristically bounce between their tasks and might finish or might not. They often procrastinate and don't follow through. They frequently have trouble with time, take longer with tasks, or simply don't turn their work in on time. They often have time management problems, organizational problems, and difficulty making and sticking to financial budgets. People with inattentive attention deficit disorder often pay poor attention to detail, and they make careless mistakes. It is almost as if they rush through a test and then look back at an answer that they knew but missed because of their haste. They are often forgetful of little things. They often appear tired or sluggish. They also complain of feeling bored, being bored, or other people view them as bored. Inattentive ADD looks exactly like hyperactive ADD on a SPECT scan. The blood and electricity have drained out of the prefrontal cortex, which leaves the two characteristic dark areas where the brain is essentially asleep. The only substances that have been shown effective in activating the prefrontal cortex in inattentive ADD or hyperactive ADD clients through SPECT scan imagery are either a stimulant or Addr. Dr. Amen has identified 4 additional and distinct types of ADD. Most clinicians are not aware of these or disagree with the idea that they are separate types of attention deficit disorder. However, Dr. Amen is the worldwide leader in the field. Dr. Hallowell, who is the second most prominent doctor in the field of ADD, views these categories as valid types of ADD as well, but tends to describe them as ADD plus another disorder, such as depression or anxiety. Dr. Amen identifies the third type of ADD as overfocused ADD, while Dr. Hallowell would see this category as ADD and OCD. On a SPECT scan, this condition shows the characteristic depletion on the surface scan of the prefrontal cortex. However, on the internal SPECT scan, the white, red, or yellow colors mean that the brain is working 15% hotter than it should be. The only exception to this is in the bottom part of the brain, or cerebellum. This part should be white, red, or yellow, which denotes a sufficient amount of dopamine, an energizing neurotransmitter. The 2 areas of the brain that are affected with this type of ADD are the cingulate system, which runs straight down the middle of the brain on an internal SPECT scan, the tip of which can be seen in this image. This part of the brain allows people to be flexible. If this part of the brain is not white, red, or yellow, that would indicate an appropriate amount of flexibility. A person with this type of brain scan would tend to be calm and able to deal with interruptions. If the middle part of the brain were white, yellow, or red without the characteristic depletion in the prefrontal cortex, that would rule out a diagnosis of attention deficit disorder. It would also indicate a diagnosis of either anxiety disorder, obsessive compulsive disorder, or oppositional defiance disorder, which essentially means disagreeing with everyone about everything, or PMS 3 days out of the month. If the prefrontal cortex and the cingulate system both have problems, that would indicate overfocused ADD. The other part of the brain that can be affected in this particular type of ADD is the basal ganglia, and is identified, again, in image 2. The basal ganglia are located in the top third area of the internal SPECT scan and to the right and left of the cingulate system. If these areas are white, yellow, or red, it would connote anxiety, irritability, or obsessive and/or compulsive thoughts or actions. The symptoms of overfocused ADD are 6 or more of the inattentive symptoms and 6 or more of the following symptoms: a tendency to be oppositional or argumentative, being super-organized, an intense dislike of change, difficulty seeing options in situations, trouble shifting attention from subject to subject, an intolerance for being interrupted, the tendency to worry, others viewing the person as being worried, a tendency to hold their own opinion and not listen to others, needing to have things done a certain way or getting upset, a tendency to be compulsive, to hold grudges, and a strong tendency to get locked into negative, obsessive thoughts. The cingulate system and the basal ganglia respond very well to SSRI antidepressants that increase serotonin, an inhibitory neurotransmitter that has a calming tendency. Common antidepressants are Lexapro or Prozac. These work exceptionally well, but can have side effects such as sexual problems, weight gain, and a blunted affect or mood. Natural supplements such as the herb St. John's wort or other serotonin precursors such as 5-HTP work well for mild to moderate symptoms and generally have very few side effects. Many clients have reported that the natural supplement Mood Care also works exceptionally well. Mood Care is a combination of the same proprietary homeopathic blend found in all Addr products with the addition of St. John's wort. Overactive basal ganglia also respond extremely well to GABA, a natural precursor to the GABA neurotransmitter. GABA is an inhibitory neurotransmitter that slows the neural firing, calming people naturally. I have found that GABA is almost always low in those who have attention deficit disorder. GABA can be taken in combination with a stimulant and is an added ingredient in most of the Addr products. If the basal ganglia and the cingulate system are overactive, then a serotonin enhancer in GABA may be sufficient treatment. However, if the condition is overfocused ADD, a stimulant or the Addr supplement may prove to be helpful. It is important to be careful, though, because Dr. Amen feels that if a stimulant is used first, it could exacerbate the basal ganglia and the cingulate system symptoms of irritability, anxiety, or obsessive thinking. Therefore, it is usually best to use the serotonin enhancers first for a couple of weeks, although this could further depress the prefrontal cortex. There is a delicate balance between these different areas of the brain. Addr and Mood Care do not depress the prefrontal cortex or overexcite the cingulate or basal ganglia, and either product might prove to be a good choice for the symptoms consistent with this type of ADD. Temporal ADD consists of the typical problems in the prefrontal cortex, as well as organic damage to the brain in the temporal region, which is in the middle and both sides of the brain. This damage is usually significant and might well be permanent. It can result from a blow to the head, chemical assault from paint fumes or other chemicals, or genetic problems. The symptoms of temporal ADD are a tendency to have a short fuse, sensitivity, mild paranoia, periods of confusion and feeling spacey, panic or fear for no particular reason, misinterpreting comments that are negative when they are not, and a quick temper and rage with little provocation. Irritability builds, then the person explodes, then it recedes, leaving the person feeling exhausted. The person also might have a history of family violence, a head injury, experience headaches or abdominal pain of unknown origin, periods of forgetfulness or memory problems, suicidal or homicidal thoughts, frequent periods of deja vu or I have been here before, and they might even perceive visual changes such as seeing shadows or objects changing shape out of the sides of their eyes. As with all the ADD subtypes, if a person scores frequent or very frequent 4 times, the diagnosis is possible. 5 times it becomes probable, 6 or more is positive for the condition, and 7 or 8 to feel completely sure. Clinically, the dominant symptom I see in this type of ADD is simply the observation and feeling that this type of client would like to reach over and choke me, even though they're not angry at me and they're trying to hold themselves back. Anyone who comes into contact with this particular kind of ADD feels the same way. These are the people who get involved in road rage. It is entirely possible that if these people use a stimulant, they will become even more angry and disruptive. Dr. Amen recommends using a mood stabilizer such as Lamictal or Abilify. When the client is stabilized on one of these medications, he then can assess whether they are able to tolerate a stimulant. These particular drugs work on the GABA pathway. As discussed previously, GABA is an inhibitory neurotransmitter that slows the neural firing and thereby moderates mood. Based on the SPECT scans in our study, Addr not only activates the prefrontal cortex, but often acts as a mood stabilizer, so the danger of exasperating the anger problem is avoided. Original Addr also contains GABA in the formulation. Essentially, limbic ADD is depression and attention deficit disorder. In a SPECT scan, the limbic system shows up in the very middle part of the deep scan as shown in this image. If that section is white, red, or yellow, it means that it is working 15% hotter than it should be. Treatment consists of not only a stimulant, but an Ssri antidepressant such as Zoloft. To address the symptoms consistent with this condition naturopathically, the client would use Addr for the prefrontal cortex and St. John's wort, 5-HTP or mood care for the limbic system. The symptoms of limbic ADD are 6 or more symptoms of inattentive ADD and 6 or more of the following: negativity, irritability, low energy, mood swings, chronic low self-esteem, a tendency to be socially isolated, a lowered interest in things that the person usually finds fun, frequent feelings of excessive guilt, hopelessness or helplessness, and undergoing sleep changes. This sleep disturbance could be either too much sleep or too little. Ring of Fire ADD is the most difficult type of attention deficit disorder, both to diagnose and to treat effectively. On a SPECT scan, the entire brain is overactive and lit up like a Christmas tree. It is hard to delineate whether a person has bipolar disorder or Ring of Fire ADD because the scans for both disorders are very similar. The main difference is that the overactive areas, although extensive with bipolar disorder, are more haphazard and pockmarked than the solid white that shows up with Ring of Fire ADD. The symptoms of this disorder are the following: periods of increased talkativeness, displaying unpredictable behaviors, talking fast, angry or aggressive behavior, inflexible, rigid thinking, cyclic mood changes of highs and lows, demands to have their own way even when told no multiple times, periods of increased impulsivity, grandiose thinking, anxious or fearful, feeling that thoughts go fast, periods of mean, nasty, or insensitive behavior, and hypersensitive to noise, touch, clothes, and/or light. However, both this type of ADD and temporal ADD are difficult to diagnose by a written test alone, and these subsections are less valid than the others. The treatment for this type of ADD is complex, and it is not unusual for several different medications to be needed for effective symptom relief. This type of ADD responds poorly to stimulant medications such as Ritalin or Adderall when used alone. Dr. Amen suggests using a mood stabilizer, especially an antipsychotic mood stabilizer such as Abilify or Risperidol, to calm the brain before even considering using a stimulant. Once this has been done, at times it is possible to use a stimulant for better focus. But if the person becomes more hyperactive or angry, the stimulant should be discontinued. Clients have reported good success using Addr with the particular kinds of symptoms consistent with this type of ADD. It can be used without worrying about worsening the situation. At times, an antipsychotic needs to be taken along with Addr, but often Addr is sufficient because it seems to allow the brain to focus while increasing relaxation.